Right. Good evening, everyone, and welcome. My name is Irina MacArthur. I'm Director of Patient Experience at Inception Fertility, and I'm truly grateful for you to join this webinar tonight and this conversation. We know that fertility journey is very, very challenging, and it might be very tough for some individuals and couples to navigate that journey together. And I'm honored to be here today with Dr. Dolmar. She's our Chief Compassionate Officer and leading expert in emotional experience of infertility. Dr. Dolmar has dedicated her entire career to helping couples to understand the unique challenges this journey can place on relationship and how to stay connected through it. So tonight we'll be exploring, why infertility can feel so different for each partner, the stress it plays on relationship and daily life. As well, we will discuss some particular strategy and communication tools to help couples to stay connected and supported throughout this journey. We want the sessions to be very supportive and interactive. So at the end of the webinar, you are welcome to ask question live. We actually prefer that you ask question live. So you can simply raise your virtual hand and I will unmute you and you can ask your question. Alternatively, you can drop your question into Q&A box and I will read those to Ali. Thank you once again for being here. And with that, I am pleased to turn it over to Dr. Dom.
Thank you, Irina. Hi, I am Dr. Ali Domar. I'm a health psychologist by training. And as Irina said, I have spent my whole career studying the relationship between stress and infertility, why infertility causes so much stress, et cetera, et cetera. And for anyone who's attended one of these webinars in the past, you know that I'm obsessed with questions. And we started a new format about 3 months ago where we actually give people the opportunity to answer questions live. Like Irina unmutes you and you can ask me the question, which is a whole lot more personal. And it means that I can actually have a conversation with you. And I enjoy it a lot more and it makes me pretend that I'm a talk show host. If you don't want to do that, you just put it, I think, in the Q&A box. And I try to only talk for like 20 minutes and really, the meat of the issue is really what you all are going through and the questions that you have about yourself and your relationships. And so I do have a habit of talking a lot and I will try not to talk a lot, because I really do want to take your questions. So anyway, let's go to the first slide, please. So I've got to pull the computer closer to me because I'm too old to be able to read my own slides. So, one of the things I've done as a psychologist over these last few decades is I do individual counseling, I do couples counseling. So I've probably seen hundreds of couples going through infertility treatment. And I have still, after 37 years of doing therapy, I have never seen a couple who are in the same place at the same time. No matter how much they love each other, no matter how much they're supporting each other during their infertility journey and during any other crisis you're going through, people just handle infertility at a different pace. Usually, but not always, the female, if it's a heterosexual couple, the female member of the couple wants to move forward more quickly. And so she will tell me that her partner is holding her back from having a baby. And usually, but not always, if it's a heterosexual couple, the male partner will tell me that she's pushing him to make decisions he's not ready to make. I'm not sure why that's pretty consistently the case, but it does seem to be most often. In addition, another thing that couples report to me is that there's usually a discrepancy in how much they want to talk about their infertility. And almost always one person wants to talk about it a lot more than the other. Usually it's the female member of the couple, but it may be the identified patient of the couple who wants to talk about it a lot and will say to me, we never get a chance to talk about our infertility. And the other member of the couple will roll their eyes and say, it's all we ever talk about. So I've seen it all. I think this, if you are experiencing one or both of these situations, it simply means you're a normal couple. And if you're not experiencing this situation, consider yourself lucky because it's challenging to be at a different place and to have one member of the couple want to talk about it more. Next slide, please. So I've talked about this before, so I'll just really quickly go through this. Infertility is a unique disease. It is a disease as identified by the World Health Organization, and it's unique in that it truly impacts every aspect of your life. It affects your relationship, as I said, because I've never seen a couple in the same place at the same time. It affects your sex life because it can't not, in effect, because people start to associate sex with failure. Sex tends to lose the spontaneity, the fun, the intimacy. And I think in February, we're actually, for this webinar, we're going to have a guest speaker, Dr. Elizabeth Grill, who actually is a certified sex therapist. And I can't wait to interview her for this webinar. And she'll actually talk about how to bring back the spontaneity and intimacy back into your sex life because infertility can hit a sex life hard. It is going to impact your relationship with your family and your friends, most likely, because people don't get it if they haven't been through infertility. They often don't get it. They may say stupid things, they may say insensitive things without even realizing they're insensitive or stupid, or maybe they do realize. Sibling rivalry never dies. And, it may be that, you're getting along fine with your siblings, but your brothers-in-law and sisters-in-law are driving you insane. um, in all likelihood, your family members, your siblings, your partner's siblings, your friends are all getting pregnant, and they're probably getting pregnant easily. And for whatever reason, people always have to tell you how quickly they got pregnant. And most people going through infertility, most women going through infertility, have a really hard time with other people's pregnancies. And so, if you're having a hard time with other people's pregnancies, it means you're normal, but it might mean that other people's pregnancies are hard. And especially if it's a younger sister or a younger brother that produces the first grandchild, sibling rivalry never dies. And so it can impact your relationship. And I'm seeing that a lot now during the holidays, that my patients don't want to go home. They don't want to see their family or friends because they don't want to see pregnancies or be pregnant for pregnancy announcements or anything like that. It can affect your jobs for one or both of you. Infertility treatment is not flexible. Like if you are going through an IVF cycle, you have to go to the clinic for blood work and ultrasound, no matter what your job demands are. You can't travel during an IVF cycle. We ideally don't want the sperm to travel during an IVF cycle. IUIs are set at a certain time. And so it's really tough for a lot of people when you might feel that infertility is a full-time job, trying to balance your job and the demands of your job and the restrictions of your job as you're trying to navigate infertility treatment. Um, Financial security is a big deal. Treatment is expensive. I happen to live and practice in Massachusetts where there is a state mandate to cover 6 IVF cycles. But a study came out a couple of years ago that showed that only about a third of all residents of Massachusetts actually had all 6 cycles fully covered because insurance companies are now throwing out things like deductibles and co-pays and not covering medication. And so people end up often spending a lot of money on treatment. And two members of the couple may not agree on how much money to spend on treatment or what kinds of treatment. It can impact your relationship with God, and the two of you may have very, very different relationships with God. But in general, people going through infertility feel that God's not answering their prayers. They want to know what God's plan is. They want to know if they're being punished for some past behavior. And it affects your body image. Whoever has the diagnosis, it tends to affect their body image. And, especially if the woman is receiving infertility treatment, which may or may not cause some weight gain, that can affect how she feels about her body. And all of those things are going to impact your relationship because people just don't cope with infertility in the same way. Next slide, please. So, as I've sort of hinted at, whoever carries the diagnosis, if you have a diagnosis, the infertility is going to have a completely different meaning because one of you is, carrying the diagnosis, unfortunately or fortunately, no matter who has the diagnosis, it's almost always the woman who gets physically treated with medication or procedures. Um, but, a lot of men with male factor infertility is just about half of all diagnoses these days. And so there are a lot of men who get hit really hard with an infertility diagnosis and the guilt they feel watching their partner go through treatment to, in effect, compensate for their subfertility. And so, don't assume that you know what your partner is going through if your partner has the diagnosis. It can affect them very differently than it affects you. Um, In general, when you look at heterosexual couples, men tend to express less stress. They tend to be more stoic. But in fact, if you actually look at the research, most men going through infertility, whether or not it's their diagnosis, are anxious, and about a third of them are depressed. And I've run groups for men, and I've talked to them about it, and a lot of them say, "Look, my wife is a mess, and I feel like I have to stay strong, and no matter how." Badly I feel or sad I feel if a cycle doesn't work or if we have a miscarriage, I feel like I have to be there to support her and I can't let myself fall apart because if I let myself fall apart, we are going to fall apart. And so I have to just tuck my feelings away. I can't let my partner know how sad I am. Next slide, please. So, some things that you should think about as you approach infertility with a partner. This is often the first crisis you're facing together. I mean, you might have thought dating was stressful, or planning a wedding was stressful, or buying your first house was stressful, all of which are stressful. Infertility is kind of unique. And you might face wedding stress or dating stress or job stress in similar ways. And it might feel really uncomfortable that the two of you are not feeling the same stress from infertility or that parts of infertility are stressing you out in different ways. And so I just think you need to think about the fact, as I said, that whoever has the diagnosis is going to react to their infertility differently from their partner. Whomever is getting treated, and again, most often it's the woman who gets treated, often to compensate for a male factor. And if the person, if the male partner is on medication, he might have the same mood swings that women have when they're on medication. And so just be aware that the treatment is going to matter. Um, Whoever spends more time researching infertility, that matters too. I mean, in general, it tends to be women who spend a lot of time online researching infertility, but I've met a lot of men who spend hours and hours online researching what a diagnosis means, what the best treatments are, which is the best clinic, who has the highest success rate, how much things are going to cost. Um, it also matters which of your siblings or close friends are pregnant and are having babies, because as I said, women tend to develop almost a phobia when other people get pregnant. And, I have a patient, I think it took her 2 years to meet her husband's new nephew. And he visited the baby all the time, and she just couldn't do it. And obviously, it caused a lot of friction from within the couple. Um, whoever worries most about money, that infertility, as I said, even if you have insurance coverage, you still tend to get hit with co-pays and deductibles. And so whoever in the relationship worries more about money, it's going to matter. And whoever is more comfortable talking about their feelings. And I think we always assume it's women are super comfortable talking about their feelings and men aren't, but that's not true. I know a lot of women who keep their emotions very close to their chest, and I know a lot of men who are very forthcoming about how they're feeling and how sad they are and how frustrating this is and just how lousy they feel going through this whole process. Next slide, please. So what can you do? I mean, if you're attending this webinar, you're going through infertility. You may be already going through infertility treatment. You may have had some unsuccessful cycles. So I think the number one thing that I have seen in couples is that each member of the couple assumes, sorry, can we go back? No, back there. Do not assume that the way you're coping is the right way for your partner to cope. The way you are coping is the right way for you, but it's not necessarily the right way for your partner. And your partner should not assume that the way they're coping is the right way for you. It's really okay for the two of you to cope in different ways. You just need to be able to express what works for you and what doesn't work for you. And please don't pressure your partner to cope in the way you do. So if one of you wants to talk about it more or do research more, don't assume that's going to work for your partner. Let them cope in the way they need to cope. However, if one of you has found a really good coping strategy that's actually helping you feel better, share that with your partner. They may or may not decide to take you up on trying it themselves, but if you found something that works for you, definitely share that. Um, don't assume that your feelings are appropriate and their feelings are not. And so if you are feeling very sad and very depressed and very isolated, and yet they seem to be feeling okay, that doesn't mean that you're coping in the right way and they're coping in the wrong way. Conversely, if you're actually doing okay, but your partner is a mess, don't assume that they're weak or anything else. It just means this is hitting them in a different way than it's hitting you. Um, don't assume that you feel the same urgency. However old you are is going to contribute to urgency. I mean, women are extremely aware of the ticking clock. But men are too. And if men are not aware of their ticking clock, they should be, because sperm don't do well with aging, not in a more as not in as obvious a way as eggs, but sperm don't do great with aging. And so there should be urgency on the part of both of you if you're over 35 to try to get pregnant as quickly as you possibly can. We don't talk that much about the impact of aging on men, but I can tell you that the last couple of years of research have been really eye-opening for me. And so I encourage couples and individuals, specifically men, if you want to have a baby, it makes sense to move forward as quickly as you can. Also, do not assume you feel the same way about disclosure. Um, Again, I don't mean to generalize or be sexist or anything like that, but a lot of the times women seem to feel more comfortable talking about their infertility, sharing their experience, seeking out other people who might be going through infertility. And especially if it's a male factor, your partner may be absolutely insistent that you don't tell anybody. And, I think if that's how your partner is coping, you really have to respect that and not tell people it's a male factor infertility, because, men tend to associate, sperm counts with virility and masculinity and guyness. Women, I think, a little bit less in terms of their femininity, maybe not, but a lot of men, men also tease each other a lot more so than women. And I think if a man is dealing or trying to cope with male factor infertility, he does not want his friends teasing him about it. Men can be cruel. They say they're teasing, but I find it cruel. Next slide, please. So, as I mentioned, for a lot of people going through infertility, this is their first crisis. If it's not your first crisis and you've been through a crisis before and you've learned ways for the two of you to get through a crisis together, dig up those old coping skills and use them now. Because, we often learn the hard way how a couple can get through a crisis. And if you've learned things that work for the two of you, even though it may not work for anybody else, more power to you. But I think it's really important that you learn, if you haven't been through a crisis together, or if you haven't learned how to communicate with each other during a crisis, this is a good time to learn. And the skills that you develop during infertility will come in very handy for the rest of your lives. So one thing that I very much push, suggest, force, make my patients to do is to do what I call paired listening, and to do this every day, and to schedule a time every day, maybe, after dinner or before bed or whatever, to schedule, let's say, 5 or 10 minutes together to actually talk to each other, which means no TV, no radio, no phones, no video games, no nothing, just the two of you sitting facing each other, no distractions, no outside sound, and actually just talk to each other and have one person talk for, 3 or 4 minutes while the other person just listens. You can't interrupt. You can't let your mind wander. You actually have to hang on to their every word. And then the other person gets a chance to talk for the same 3 or 4 minutes. And then you discuss what you have learned and what you can share and what you can learn from that conversation. And then you can't talk about infertility the rest of the day. And what this does is for the partner who wants to talk about it, it means they're guaranteed a chance every day to talk about the infertility. And for the partner who doesn't want to talk about it as much, it means they're not going to be talking about it at every opportunity they're together. So it's a time limited exercise, but it's a very focused exercise. Next slide, please. So just some insights that I wanted to share that I've learned over the years. And this goes not just for infertility, but for pretty much anything else. Be aware that no matter how much you love your partner and how much your partner loves you, you can't read each other's minds. And so you have no idea what your partner needs. So what you need to do is you need to think about what your needs are and communicate them. So I had a patient years ago, and I love this idea, and I actually suggest this to a lot of my patients, is that she and her husband, and so really, they each thought of, I can't remember if it was 10 or 20 things that their partner could do for them when they were having a bad day. So they made a list of, get me ice cream, massage my shoulders, watch, whatever TV I like to watch, whatever. And they made this list and they handed the list to their partner and just said, keep it. And when I'm having a bad day, bring out the list. And I think it's a really good thing because, you know, I've been married 35 years. I don't know exactly what my husband needs when he's having a bad day, but if he would write everything down, I'd be able to say, oh, today I'm going to do seven, whatever. So just think what your needs are. And then think about, in terms of your needs, which of your needs is your partner capable of meeting? Because there's no one in the world who can meet all your needs. I can guarantee that. But if you could think of 8 needs that you have on a day-to-day basis, maybe your partner can meet 2 of those needs, or maybe your partner can meet 3 of those needs. And then think about who else in your life can meet your needs. What about other family members? What about your friends, your coworkers, clergy, neighbors? Think about which of your needs other people can meet, and think of which of your needs you can meet yourself. I think this is something very uncomfortable for women. We're brought up to think we're being selfish to take care of ourselves, but it's really important. If you need the Haagen-Dazs, go get yourself Haagen-Dazs. If you want to splurge on, some gooey TV show, splurge on the gooey TV show. Whatever you need, you got to learn to meet your own needs. Next slide, please. So, one of the easiest and hardest things to do when you're in a relationship is to try to see things from your partner's perspective. And I remember, gosh, 40 years ago, I was doing my postdoc and I was having a difficult time with a coworker and he was driving me insane. And I went to my boss, our boss, and I basically said, I can't work with this guy. He's mean to me. He plays practical jokes on me, blah, 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 blah. And my boss said to me, there's an ancient Native American expression that says, do not judge somebody until you've walked a mile in their moccasins. And I know that, and so he said, you need to think about what your coworker is going through and think about things from their perspective. And in fact, it was a very eye-opening experience for me. And it has helped a lot in my relationships, both with my husband, with my friends, with my patients, is to just take a step back. When you're upset with your partner, take a step back and think, where are they coming from? Why is this a trigger for them? Why am I a trigger for them? Um, if you have a disagreement, you know how you're feeling. How are they feeling? Are they angry like you are? Are they sad like you are? Are they frustrated? Are they feeling lonely because you don't understand them and vice versa? Do they have triggers you don't know about? All of us have triggers from our childhood and growing up. Maybe your partner doesn't know they have triggers. Maybe they've never told you about their triggers. Find out what their triggers are. And do you have triggers you haven't told them about? All of us have triggers. And you need to start recognizing what your triggers are, and you need to share this with your partner so that they can avoid triggering you. But honestly, I think the most important thing in a relationship in terms of couples communication is just trying to see things from their perspective. Why are they upset? Why are they angry? Why are they frustrated? And that can help a lot. Or if you have no idea, you can say that to them. Look, I'm trying so hard to understand where you're coming from, and I can't figure it out. Please explain to me where you're coming from. They can't blame you for that. Next slide, please. So, as I said before, I really would love to take questions. I would like to personalize this webinar. You can either raise your hand and Arena will unmute you and you can ask me directly, or you can do the Q&A box. If you really don't want to share anything, I have an email address where I answer questions for all Prelude patients. And it's very easy. It's askallie@inceptionllc.com. But I'd really rather you ask it now because I can guarantee you, if you have a question, there's somebody else on this webinar who has the same question and would really benefit from hearing the answer, if I know the answer. So, Serena, do we have any questions?
Yes, Sally. The first question is, what can we say to each other in the tough moment that actually helps not make things worse?
Well, I think it really depends on the circumstance. I think, getting angry at your partner because you don't understand what they're going through or because you have a difference of opinion doesn't help. I think if you're sort of locked in combat, it's a good idea to just say, you know what? I need half an hour to process all this, and then we should come back and talk about it. And then you can both calm down. It's very hard to make up when you're both angry with each other. And I have found that if you can take a little time apart and think things through, take some slow, deep breaths, have a glass of water, um, again, seeing something from their perspective is like 90% towards the goal. And if you don't understand their perspective, you need to tell them, like, I don't know where you're coming from. You need to explain to me where you're coming from so I can better understand so that we can come and meet in the middle.
Thank you.
That answered your question.
I see the hand up.
Yeah.
Kavita, I will unmute you and please go ahead and ask your question.
Hi, Kavitha. You
Hi.
need to, hi.
Well, I would like to share my experience, and I'm literally confused right now. So that's the reason I want to explain my situation first. Maybe then you can understand what I wanted to ask you.
Okay.
So I got married. It's been 3.5 years, and we are been trying uh, from like 3 years itself. And I started my IVF journey in 2023.
Wow. Okay.
2023, I had my first IVF in December. But unfortunately, I couldn't do transfer because I had some kind of infection, vaginal infection, so I couldn't do. And this was in my home country in India.
Mm-hmm.
Later, I have done IVF here in US. That's this year, 2025. Uh, 2025. So I had my first IVF. I mean second IVF, and uh, I had my first transfer in May, and it was not successful.
Oh, sorry.
And tomorrow I'm having my second transfer, and I'm going through a lot of like hormonal changes. Like I'm one day I'm going too hyper, and someday I'm going too emotional, and I started crying. I'm yelling a lot, and I know it's because of my maybe medication or uh, hormonal
Yep.
effects. Yeah.
Definitely.
And I, I had 11 years of work experience. Currently I'm not working, I'm at home. So I most of the time I'll be sitting at home and watching TV or cooking, doing something stuff, not uh, doing anything like which
Mm-hmm.
and deviates my mind. So here my problem is like the fertility treatment should be like it's a problem with my husband. He is having low sperm count and DNA 40% DNA damage, and quality is not that good. We have good quantity of eggs right now, uh, but the only problem is my husband. He's supporting me a lot. He's working all day. He's taking care of me. He's like literally supporting me each and everything. But still, I get angry on him.
Mm-hmm.
Sometimes I feel so guilt, like I'm just pushing on him too much. Initially, I was not like this. I mean, on my first IVF, I I never blame him a guilt card. I never showed him a guilt card. But these days I'm going too extreme and I'm showing because of your fault. I'm bearing everything, and I'm not able to. Uh, I mean I'm not able to do what I would say. Why I should bear all the pain and all,
Well,
and
see, the thing is, Kavitha, that, as I said before, infertility is a disease.
mm-hmm,
And, none of us anywhere in the world do anything that causes infertility. And my guess is, when there's a male factor infertility, the man feels terribly guilty. And especially when their partner is going through an IVF cycle and they're having shots and blood tests and ultrasounds and an egg retrieval. And on top of that, almost all women who have the medications do have mood swings. And so not only is he, as a typical man, feeling terribly guilty that you're having to go through this because of his fertility diagnosis, but you're taking out your frustration on him. So it's normal on both sides because, you feel awful that you're going through this and he feels awful that you have to go through this. And so, I think it's important that you get support, or anyone going through infertility, I think, could benefit from support. I think, especially with male factor infertility, that you get support outside of your relationship with him. So whether it's with a family member, I'm a big believer in Resolve, the National Infertility Organization. So if you're in the US right now, are you in US or Canada?
US,
US.
Atlanta.
So, if you just go to the website resolve.org, they have a ton of resources and they have support groups because I understand all the feelings someone has when their partner has male factor infertility, but you just can't take out your frustration on your partner because I suspect they're already feeling awful. And yet you need support. You need a chance to vent. You need a chance. And so I would definitely start with resolve.org, because they have some really great resources. I would also suggest that ASRM is the American Society of Reproductive Medicine, and there are something like 700 mental health professionals who specialize in reproductive medicine. And even if you would have one visit with someone just to give you a chance to vent and to learn some coping skills that would work for you, I think that would benefit both of you. Because I don't want you going through IVF by yourself, but it sounds like, there's a lot of sadness in your house right now. Does that make sense?
Yeah.
Yeah, I would try those two things. You're not alone. You have to remember that there are millions of people going through what you're going through right now. But I think that, you would benefit from support other than from your partner. Okay.
Okay. Thank you.
Thank you. Our next question is, we had our first transfer in July and it failed. We're preparing to transfer again later this month with a new protocol. I'm very excited and I feel I have grieved to a healthy amount from the first transfer. My husband is much more reserved and almost seems scared to going into the next transfer. How can I comfort him and help him to get excited for the next transfer?
Well, that goes right back to what I said at the beginning is the way you are coping with this is you're being really excited and optimistic, and that's working for you. And it's easier to go into a transfer cycle being excited and optimistic because that's your coping style. But it sounds like your partner doesn't have the same coping style, and that your partner is feeling anxious and is holding back because they're probably so afraid it's not going to work. And so you need to be excited and optimistic because that's how you feel and that's how you need to feel. And your partner needs to feel reserved and holding back because that's how they are coping with the stress of this. And your partner may also feel that they're going to save their excitement for when it works, not for right now. So I just think this is one of the hardest parts of going through infertility when your partner and you don't have the same coping style. But you really have to respect each other's coping and be excited with your family, be excited with your friends, but let your partner be who he needs to be. Okay.
Thank you. The next question is, my husband has great positive attitude and we consider myself as the negative one.
It means you're normal. Sorry, I don't mean to laugh, but you know, being positive and optimistic, is just it's makes going through infertility easier. But I have to say, the thing that worries me if someone starts a cycle and they're very optimistic is if the cycle doesn't work, they crash and burn. If someone goes into a cycle extremely negatively and pessimistically, it makes it harder to go through the cycle. I can't tell you there's one right or wrong way to go through a cycle. I think trying to go through at sort of a moderate level and just take care of yourself the best way possible and take care of your partner the best way possible. Um, your attitude is not going to affect whether or not the cycle works. It will affect how hard or easy the cycle is for you. And it will affect whether or not you'd be willing to do another cycle if this one doesn't work. And, obviously, what I want is for everyone to get pregnant with a healthy pregnancy the first time they try. But if not, you may need to do it a couple more times before you are successful.
Thank you. Ali, there's actually clarification to this question as well. I believe that my negativity is almost a protective mechanism to prepare us for a possible set outcome. How do you navigate two different mind frames? And we are preparing for egg donation.
So, I'd say how to prepare for two different mind frames. I just say, bless you and respect the fact that you're approaching this differently. I think for a lot of people going into a cycle with zero expectations, as I said, probably makes it harder to go through the cycle because there are a lot of demands of the cycle, but it may make it easier if it doesn't work. I do worry when people start a cycle and they're like, rah, rah, it's gonna work. My due date's gonna be this date, and I'm gonna have a girl, and we're gonna name her this. That scares me because if the cycle doesn't work, as I said, there's a big crash. It's a very fine line to walk as you do a cycle because you want to pump yourself up enough to get through the cycle and or pump yourself up enough to support a partner to get through the cycle, but you don't want to pump yourself up so much that it becomes really hard. I think one of the things that you can do together is to come up with a plan B. So if God forbid the cycle doesn't work, what would plan B be? Sorry. What would your backup plan be? Would you sit down with your physician and come up with a different protocol? Would you try to change your lifestyle behaviors? What can you do differently if this cycle doesn't work? And that makes it easier because if you do a cycle and it's just you're so focused on this cycle working and it doesn't, you're in effect left empty-handed. But if we have a plan B, if the cycle doesn't work, you go like, okay, we can do this. We can try plan B. And you may decide you don't want to do plan B when it comes to it, but at least you have a backup plan. And I think it makes it easier going into a cycle knowing you have a backup plan.
Thank you. The next question, is it true that having positive mindset can help the first embryo transfer be successful? How much does mindset really matter?
Oh, God. I was afraid someone asked this question. So I've been researching the stress infertility connection my whole career. I cannot tell you we have a definitive answer yet. I'm doing a study right now where we are looking at physiological stress. So, and I don't want to bore you with what it's like to be a researcher in this field, but in effect, all the research up until now, almost all the research up until now, when they've looked at whether or not stress impacts IVF outcome, they've handed women what paper and pencil questionnaires. How depressed are you? How anxious are you? How lonely are you? How irritable are you? And the problem is paper and pencil questionnaires are really not a good way to actually assess how you're feeling. Because a lot of people do get very optimistic at the beginning of IVF cycle. A lot of people don't feel comfortable expressing on this questionnaire how they're really feeling, and that's very cultural. So we've just finished a study where and I don't know if any of you actually participated in this study, where we actually measured physiological stress during an IVF cycle. So it was cardiac stress, central nervous system stress, etc. I'm in the middle of analyzing the data now, and I'm going to be writing up the results in the next 2 weeks. And I can't share them with you until they're published. I will say that most of the research, which has looked at psychological interventions, most of the research, in fact, the vast majority of the research in the last 5 years has shown that women who go through a psychological intervention and you see their anxiety and depression come down have higher pregnancy rates than women who did not go through the psychological intervention. And so I feel very confident saying if you are planning to go through treatment and or if you're trying on your own, the more you can do to lower your stress level, I usually in a formal psychological intervention, the more likely you are to get pregnant, which means ask your doctor, is there a mind-body program? Is there a support group? Can I do one of these online programs? I'm actually doing a FDA registry trial. So in fact, if any of you actually are a Prelude patient, we're always looking for people to be part of our psychological intervention research. And we're doing a study right now with a company that's created a platform called Fertilift. And the idea of Fertilift is hands-on stress management as one goes through their first IVF cycle. And we're going to see in the next year or so if women who did that are less anxious and have higher pregnancy rates. But I'd say because all this research is ongoing, if you're going through this now, get some support, get a formal intervention, do what you can to bring down your stress level. It'll also make it much easier to go through a cycle if you have coping skills and relaxation skills and things like that.
Thank you, Ali. Our next question is, me and my partner cope in opposite ways. One of us needs to talk and another one needs space. How do we meet in the middle?
It's exactly what I was talking about earlier because that's very, very typical. I would say try the paired listening exercise, where every day you who want to talk, you get 4 minutes to talk to your partner, and your partner has to just listen to you. If your partner doesn't want to talk to you, that I mean if they don't want to take their turn, that's okay. But then you need to talk to each other. So you get your 10 minutes every day to talk about it and discuss it, and it's time limited. And it really works. I've had hundreds of patients try that, and it really does work.
Thank you. So another question is, I'll rephrase it. What are the healthier way to deal with stress than shutting down or snapping at one another?
Okay, so I might agree that shutting down and snapping at one another are probably not the most beneficial forms to handle the stress of treatment. Um, I can't tell you there's one thing that's going to work for you. So, the things that we teach, for example, in a mind body group, is we teach relaxation techniques. It's very easy to start practicing relaxation techniques. I mean, the app I personally use is called Calm. There's Calm, there's Happify, there's Insight Timer. I mean, there are lots of good apps. I think most of them have like 7-day free trials. And just try to do a relaxation technique every day, which will bring down your baseline level of anxiety. I think learning how to challenge automatic negative thought patterns is really helpful. Again, for those of you who are a Prelude patient, I wrote a book about 25 years ago, which I spent last year revising, and Prelude patients can get a free copy of it. So if you are a Prelude patient, go into your clinic and ask for a copy of my book. It's called Conquering Infertility. It is actually available. Someone just told me there's a non-Prelude version that's available online. But in Conquer, and I'm not promoting my book. I am, but I'm not. There's actually several chapters on how to challenge these automatic negative thought patterns. And I actually think we did a webinar on this not that long ago. And I believe that Arena can send people or can post the links for past webinars. I mean, I've been doing webinars monthly for like 3 years. So there's a whole menu of different webinars you can pick and choose from. But, I think relaxation techniques, learning stress management strategies, learning to communicate better, and learning just for you, what are the best ways for you to reduce your stress level?
Okay, thank you, Ali. The next question is, I work in education with young children and have experience with typical developing children, as well as children with a variety of needs. I probably have messed up my mindset. I am 44 years old and I'm extremely anxious, nervous, scared of all of what ifs for my health, as well as for as baby going through IUI with medication and almost letting the fear to hold us back. My husband is supportive and not fearful, and I'm not sure how to get over the fears. We definitely have different coping skills.
It's really interesting because when you work in a field where you see children who are not healthy or children who are developmentally challenged, you become convinced that's how all children are. When I was pregnant with my first child, in my practice, I see a lot of pregnant women who have complications, and I tortured my OB because every complication one of my patients had, I was sure I was going to have. And so when you work in the world where you see this, you think that's your whole world. And the fact is, most kids do well. I know that's not the way you see it because you work in, it sounds like special ed, but most kids do well. I also believe that we are far more resilient than we think we are. And people who have children with special needs or who, whatever, their heart just grows around them. Um, you wouldn't be trying to get pregnant if you didn't want to have a baby. And I think you just sometimes have to have faith that it's going to work out the way it was meant to work out. But no, there's no guarantee you're going to have a healthy baby. None of us have that kind of guarantee, but most of the time we do.
Thank you, Ali. The next question is, do you have suggestions on how to maintain physical intimacy in the midst of trying for pregnancy and after reproductive loss?
So I am not a sex therapist, or I'm not a certified sex therapist. I've done plenty of sex therapy in my time. And I don't want to tell you wait for February because that feels like really far away. Um, I'm trying to remember so that like the person who like specializes in this and has for a long time is Cheryl Kingsburg, Kings, either Berg or Burg, and she's going to be very offended that I don't remember. I don't know if she's written a book or not. Um, I think it probably makes sense to Google if there are any books on sexuality and infertility. To be very honest, I've never had a patient where their sex life wasn't impacted by their infertility. But there are lots of ideas on things that one can do to try to reintroduce spontaneity and intimacy. You can um, have, if you happen to have two rooms in your house, you could have one bed for baby making sex, which might be mid-cycle sex, and one bed or one couch or one kitchen counter or one dining room table for spontaneous sex. Um, Also, because so many people going through infertility feel like they have to have sex mid-cycle, it sort of takes the fun out of it. And so, just start off by enhancing intimacy by other ways, by holding hands, by cuddling, by kissing, by hugging. I know this sounds crazy, but go buy super sexy underwear because there's actually research to show that when women wear super sexy underwear, they actually feel more sexual. So it feels weird for me to say that, but there's actually research that backs that up. Um, you also have to be aware that this is a challenging time to have a normal and happy sex life. I will tell you in all honesty that if your treatment is successful and you have kids, it's going to be a long time before your sex life gets better because kids tend to also impact your sex life negatively. But if you both are motivated and interested, you can get a lot of the spontaneity and sensuality back if you work at it. But you know, if you're not pregnant by February, tune in and listen to my conversation with Dr. Elizabeth Grill, because this is actually what she does. She's a sex therapist, and most of her practice is infertility patients. But do know that it's normal for one's sex life to take a hit while you're going through infertility.
Thank you, Ali. Next question is, what kind of support programs can Prelude offer us, and what type of support groups would you recommend? We live in Vancouver Island.
So Arita and I are actually working. This is an idea I had in the middle of the night last week. We're working on creating a card. Like I don't even know how Irina is going to make it look beautiful. I come up with the ideas and she does all the work because I'm not creative and I don't do things beautifully. But we're actually going to create like an index card thing for Prelude patients where we're actually going to list everything that I or we offer to support patients. We don't have support groups right now. Although I got an email about 3 hours ago that our chief marketing officer is super interested in me trying to record some like mind body groups for Prelude patients. A few of the Prelude clinics do have mental health professionals on site, and all of them have a relationship with mental health professionals. So ask nurses. The nurses know this stuff. They know who in your community they recommend. A lot of mental health professionals offer support groups. And as I said, Resolve offers support groups in every state. But I'm a huge believer in Resolve support groups. I actually ran Resolve support groups for a research study I did years ago, and they're amazing. They really are. I
Yes, I
still get invited to reunions from some of my Resolve support groups that literally met 25 years ago.
yes, I agree, Ali. A lot of the nurses told me that they actually hosting their own internal support
Yeah.
groups for
It's the
patients.
nurses. The nurses know. The nurses know what to do. The nurses know what to say. The nurses know what's out there. I'm not dissing the physicians, but this is what nurses are really good at, is really taking care of their patients.
Thank you, Ali. So our next question is, what if we disagree on the next step of the treatment?
Okay, so almost everyone disagrees over the next step of treatment. Like it's very hard, as I said, to be in the same place at the same time. And I think if you really are having a serious disagreement, you need to see an impartial third person. And I've done that a lot where somebody wants to move on to IVF and the other one doesn't, or someone wants to move on to donor egg or the other one doesn't. And then you need to meet, even if it's one session with a mental health professional. So you can either ask at your clinic who they recommend or go to asrm.org and go under mental health professional group, and it's literally listed by state. And so there are shrinks like me who specialize in reproductive medicine in every state, and actually, I think even some countries. But this is hard to work out yourself. But a good mental health professional can help you figure out how to meet in the middle.
Thank you, Ali. The next question, I love this question. It's actually coming up every single webinar that we're hosting, I think, Ali. So how do we talk to friends or family who mean so well but say the wrong things to us?
I always say this. Do you know how many mothers-in-law I've seen in my office where I just yell at them for an hour about what my patients are going through? So this is what I say, because you know what? I do believe that most people mean well. However, we're in the middle of the holiday season and people either don't mean well or just say stupid things without thinking about it. All of us say stupid things without thinking about it and then hopefully feel terrible. I beat myself up for 3 days if I've said something insensitive. So this is what I recommend. I used to have an app where we actually had scripts that people could use for all kinds of challenging social comments. So what you need to do is think about the things that people say to you that really bug you the most, okay? And then come up with and memorize 3 different replies. So the first reply is a polite answer. The second reply is to educate them. And if you think they're being bitchy, then you do the third reply, which is a zinger. Okay, I had the most fun writing the zingers for the app. But so if someone says to you, I think you should lose weight if you want to get pregnant. My patients hear that all the time, and I want to slap them. So a polite answer might be, I've talked about my weight, or I have a infertility is a disease. We have a diagnosis, and our weight has nothing to do with it. That's a polite answer. An educational answer could be, I've actually spoken with my physician about my weight, and my physician isn't worried about me and is very focused on treating the disease that's causing my infertility. And a zinger could be something like, well, your weight didn't cause you to have infertility. So yeah, I can get nasty if someone goes after my patients, I can get nasty. But it feels self-protective because, people say things that hurt you so badly, and the next day you think about what you should have said. So now think about what people might have said to you in the past which bother you, or that you're afraid they're going to say to you over the holidays, and memorize some responses that are self-protective or that can educate people. I mean, I was talking this morning to the head of the Recurrent Pregnancy Loss Association. Recurrent pregnancy loss is something that, I've seen a lot of patients over my career. And we were talking about some of the celebrities now that are coming out of the woodwork. And we had both gone to an event with Tara Lipinski, the skater, the figure skater, the Olympic gold medalist, I think. And she was talking about her recurrent pregnancy loss. And we need more people to come out of the woodwork and talk about their infertility and talk about their pregnancy losses and talk about what it's like to go through IVF. Because the more people talk about it, the less likely friends and family are going to say things to you that might come across as hurtful.
Thank you. And Ali, since the holiday is approaching, do you have any advice for our patients on call on how to best handle those, questions that might come up or feelings during the holidays? A lot of the time I see patients trying to conceive for Christmas so they can have that, news reveal for family or celebrate a special moment. Any advice before I let you go?
Well, we did that last month. Remember my November webinar, which you were supposed to miss because you had an event. We actually had a webinar last month on how to cope with the holidays. So could you maybe put up in the chat what the link is so they can watch that? I mean, the holidays,
I'll send the link to everybody,
okay.
the
Yeah.
library
We try to
tomorrow.
do that every November so people can either attend it live or watch it later before Thanksgiving, because this is a tough time because when, friends and family are going to be asking you questions, making observations, you might be around pregnant women, you might be around babies. It can be a really hard time. And so, my advice is always be self-protective. Memorize some of these comeback lines. If you don't want to go home for the holidays because two of your siblings are pregnant, don't go home for the holidays. Go to a B&B, or you can get really good vacation deals right now. Or get COVID or get a stomach bug or whatever it is you need to do to be self-protective. If you miss the holidays this year, it does not mean you're going to miss the holidays next year. But you need to do for yourself what you need to do right now.
Thank you, Ali. And I think we answered all the questions that we had for tonight. Thank you once again for your time and for all the knowledge that you shared with the patients today.
I wish you all the very best of luck and happy holidays to all of you.
Thank you. Have a good evening.
Bye.